Welcome to the January 26, 2022 edition of the Urban League Jobs Network Digital Career Success Series, brought to you by the National Urban League. I'm your host, Kenneth L. Johnson, president of the Harlem, New York-based diversity recruitment firm, East Coast Executives. If this is your first time joining us, welcome. The Digital Career Success Series, DCSS, is a professional development series that helps members of our Urban League Young Professional chapters and other diverse job seekers develop new skill sets that will enhance their careers through digital platforms such as webinars, Facebook and Instagram Live, and others. The goal is to provide an opportunity for professional development right from one's computer. Today's DCSS, Work Life During the Pandemic, will feature Miss Eboné Carrington. But first, before we get started, I want to introduce you to somebody. We got a new member of the team, Dory Brown. Dory, are you with us today? Yes, Dory, this is Dory's first show. I'm so excited to be working with her. I'm looking forward to a great 2022. She's taken over the reins from Kanji, who probably doesn't want to come on camera, but she's with her just to help guide the ship if necessary. Yeah, we see her hand, so she's definitely with us. All right, Dory, thank you so very much. Please, if you're on right now, drop your name, drop the city you're representing in the chat. Let Dory, Eboné, and Kanji, and myself know where you're here from. So that'll be great. All right, look, before we get started, let me just say here, I'm extremely excited to have Miss Eboné Carrington with us today. When this topic came up, the new normal, work life during the pandemic, I could not think of anyone better to present on this topic, or anyone that I would prefer to kick off the 2022 season with. Have a great deal of respect for Eboné. I'll tell you a quick story. Before she introduces herself, I had the opportunity, I saw her on TV maybe about 2 years ago, like really doing her thing, representing the village of Harlem and New York City in general. And I'm the organizer of TEDx Harlem. So I wanted to ask her politely if she would be interested in being one of our TEDx Harlem speakers for that year. So I went to a dear friend. I used my Urban League connections and went to Arva Rice, CEO and president of the New York Urban League, and basically said, hey, can you introduce me to Eboné? And she did. Spent about 20 minutes talking to Eboné, became her biggest fan. And she did, in fact, do TEDx Harlem. If you want to check that out, maybe Dory or Kanji can drop the link, www.tedxharlem.nyc, in the chat. You can check Eboné's TEDx out and all the other TEDx out that are there. But her story is incredible. It's amazing. And I'm so excited to have her here with us today. Miss Carrington, welcome to the Digital Career Success Series, brought to you by the National Urban League.
Well, thank you, Kenneth. I really appreciate it. And it's such a pleasure and really a privilege to be here. So thank you. It's
a privilege to have you today. I'm going to let you introduce yourself. I see people are still coming in. Wow, Jamaica, New York's in the building, of course. I'm just looking at everybody who's chiming in. People are really excited about you being here. So that's a great thing. So I'm going to let you introduce yourself as they continue to come in.
Sure. Well, thank you. And I'm looking at all of the really diverse regions that this is covering. So I'm excited to talk just for a short time. And I really would like to add value by being responsive to your questions and your information. So if you have questions, I feel like a pastor a little bit, like put it in the chat. So if there are things that you would like to talk about or hear, or if there are content areas where you'd like me to expand just a little bit, just throw it in the chat and it would be my pleasure to go and circle back. So I am a managing director currently for Manat Health in their New York office. And what that really means is that I provide consultative business and healthcare strategy to managed care companies, to hospitals, to community-based organizations. And I also do a good level of teaching around leadership. And it's from that lens that I'd like to have the conversation today, really about how employers and employees can react to the pandemic and be responsive and safe and just all encompassing. So that's what we're going to talk about. I spent the past 10 years with the great privilege of running Harlem Hospital. So it's one of the 11 acute care hospitals that comprise the public hospital system of New York. And so we care for predominantly Medicaid recipients, but it is a community hospital in the village of Harlem. It's been my pleasure. And for the last 2 years, I was actually working on the COVID pandemic forefront, pushing patients in the morgue, doing different things. And so I was one of those people who had to go to work. So it's my pleasure to talk with you today about some of those experiences. And now being a total remote worker, just talking about that just a bit. So I feel like I have a good best of both worlds perspective to share with this audience.
Amazing. Every time you say that, like just the work that you were doing, the hands-on work that you were doing during the pandemic, it kind of just really speaks to who you are as a person and your willingness to support and pitch in and not just talk the talk, but walk the walk. So I'm extremely excited to jump into your presentation today and learn from Miss Eboné Carrington. Let's do it.
Thank you. So we can go to the next slide and get started. And we're going to sit with this slide just for a moment because it includes our centering thought. And one of the things that I just want everybody to appreciate is there is no new normal. I appreciate that that's the title of this webinar, but there's no normalcy in a situation like this where really you don't know what to expect. Things continue to change. The skill set that we must employ more than anything is resilience and being nimble in our approach. And so I just wanted to make sure that everyone knows that this is kind of an evidence-based research body of work. So if you feel disrupted in your professional journey, or if you feel like some things didn't meet your own expectations, you are not alone. You are in the middle of a professional pandemic as well. And so the COVID-19 pandemic disrupted labor markets globally, and some of those consequences, including furlough of jobs, other people having to rapidly move into other different skills and to broadband their abilities, really. And some of us didn't have a choice, as I said. And so this conversation encompasses people who were at home, people who had to go to work, people who had to do both. And then, because it's just my way to talk about being a parent in the workplace, what about when you had them kids at home? And so we're going to talk a little bit about what it was like to pivot from in-person work to remote, how to do that and commingle with remote schooling, and really just how to forgive yourself and exercise some gentleness so that we can all cope and you maintain your wholeness. So we can go to the next slide.
You know, Eboné, I'm looking forward to speaking about this pivot piece just because, you know, we were speaking to some of my colleagues today and they're out of the office and then they're in the office, right? And then they might be back in for a week or two and then something happens that results in them returning back home. So it's just a really interesting time. Like you said, there is no normalcy to what we're going through right now.
Absolutely. And it's so funny when you see people on Zoom and you see folks that have their mask on, you assume that they're in the office. And so there are just so many different rules of engagement and things that we have to adopt into the workforce and into our professional strategy. And hopefully this conversation lends to that. So because I'm also a teacher, I have to make sure that we have discussion objectives and that over the course of the next couple minutes, we are going to talk about how businesses and industries pivoted their recovery plans, safe reopening guidelines, just really highlines and touch points around what employers can do and what you should expect your employers to do. And maybe some of the conversation around how you manage up when that's not in place would be helpful, given the fact that we do have a good number of young professionals on. And then we're going to spend more of our time talking about the psychosocial impact of pandemic on the workforce and how you can really prepare your own head and heart space to be able to keep your good job, but also to maintain your own safety. And then my hope is that we spend most of our time in a bi-directional conversation in Q&A. So we can go to the next slide, please. I can't start a conversation about COVID without a public service announcement. It is in my DNA as a public health administrator. So I do have to say that there are a couple of things that will keep you safe. And if I could have this slide interspersed throughout the entire conversation, I would, because repetition is what's going to get you to change behaviors. And this is the most important part of this presentation. And it's how to keep yourself and your family free from COVID to the extent that you can. And it's about vaccination and boosters. It's our most powerful tool. And within communities of color, we are having disproportionately low numbers of vaccination uptake. And specifically amongst our pediatric population, we're seeing high rates, disproportionate rates of hospitalization among minority children. And so I just want to make sure that if you're a parent and you're still on the fence about vaccination, really seek to understand, talk to your pediatrician and make sure that your best tool against fighting the pandemic, which is your booster and your vaccine, are in place. To your point about people who are going in and out of the office, Kenneth, I think it's really important to make sure people have a testing cadence. You should be testing before and after you travel. You should be testing before and after you have mass congregate type of events, and before you go back to the office. So you really should know your status, and that's really important for contact tracing purposes, but also so that you're aware of your health indices. You got to wear quality masks. So really cute, bling bling masks are not what we need to have right now. We need to have, tightly insulated N95s covered with a cloth mask if you have, and just really make sure that you are masking even indoors, whether you are eating out or you're going to a party. It's still cool to wear your mask at all times. We can't stop hand hygiene. We can't stop talking about social distancing. And I really would say, stay home when you're sick. It's not just the cold, we're in flu season as well. So let's also make sure that we're maintaining safety. And I threw work wardrobe in here because it's important for people who do have anxiety about returning to the workspace, that you are wearing cotton clothing, that you can actually wash it immediately, that you don't do a lot of dry cleaning. That's where kind of COVID can rest and sit. And that you also have a little space in your home so that you're not bringing your work back with you. So have a little nook as soon as you come in, disrobe and then put on something new for your home, and that'll help protect your loved ones and your shared space. So thank you for that short public service announcement. I cannot start a conversation without that reminder. So thank you for indulging me. We can go to the next slide. So this is a concept that I really like to talk about in my leadership teaching more than anything. And it is the myth that there is something called work-life balance. And the reason that people would say, people have written about it, it's a construct that folks have, created self-help books about. But I challenge it because when you look at the definition of balance, it's a condition where there are equal parts, where your work and your life are equal, and they're not. One is far more important, but one is pivotal to your ongoing, sustainability. And so your life is not equal to your work. You are not your work. Your life is important, but your livelihood is as well. And so the concept here and the takeaway is to make sure that you have good guardrails and that you have a good understanding of when work or life is subsuming too much of your headspace so that you calibrate back. So I see it less as a balancing act and more as scales, that when one is a little higher or lower than the other, that you have kind of good ticklers, that you have your own internal compass and you make sure when you are off just a little bit. And that's something that within the COVID space is really important because the mental wellness of this entire nation is at stake. And we need to make sure that you're prioritizing your wellness. So I wanted to talk just about a moment about work-life balance and to just say, keep your job, keep your wellness, and make sure that you have them in good proportion. They will not be equal. So thank you for that.
Hey, Eboné, if you don't mind, I'd like to come in for a second here because you're speaking about, the wellness side of this conversation, and I would be remiss if I didn't speak about what they're calling the Great Resignation. Are you seeing that, people kind of protecting their wellness has resulted in them just stepping away for a little while and kind of just recalibrating? Is that what you see?
Absolutely. I see it in my industry, and I don't want to come across as a larger expert than I am, but in the health space, I would say specifically in the nursing profession, we've seen a mass exodus for many reasons. One, the psychology of what they have gone through and what they've seen these past 2 or 3 years. Two, the fact that a good number of nurses decided against vaccination. And so that was a condition of employment in almost every health system in the nation. And then they're tired and they're emotionally fatigued. And so the COVID fatigue in the health space is causing that Great Resignation. People are still very committed to preserving life and to making sure that they're a part of people's ongoing health and wellness. But going into that hospital setting and environment every day has been very taxing. So we are seeing in the nursing realm in particular, and amongst some of the administrative professionals in healthcare, really a mass exodus, some of which are just actually looking for predatory pricing. So in the United States, nursing or nurses are making twice what some of their physician counterparts are making because of economy. And so we see people just moving and becoming traveling nurses, going outside of their professional skill set just to, pursue the dollar. And so there are a lot of dynamics in the workspace right now, but specifically, I have seen that Great Resignation because people are tired and they're always not sure if their work is adding value to what their external true north is. So a lot of people's moral compass has required them to look at different options in their professional space.
Yeah, thank you for giving that big picture view. It was a question that came across and I wanted to get it out while we were here.
Oh, absolutely. And so you should really, if you are an employer, you should start to look at your attrition plans. So you're going to get me on a whole different side. But you should really look at your attrition plans. You should look at the type of employees that are leaving and expect and contemplate recruitment strategies so that you are not left with a dearth in your workforce. So if you see that a certain type of person is leaving or within a certain work broadband, you've got to plan accordingly for that. And some of that is by partnering with schools. Some of that is by making sure that you have internships and by also having, recruitment fairs so that you are not left behind the curve of the mass resignation. So there are ways and tools and strategies that employers, even small businesses, can undertake to make sure that they're not left without that critical workforce.
Excellent.
And again, keep it going. So we can go to the next slide. And these are just a couple of considerations, high level, about what we've lost and potentially what we gained from the pandemic. So as an executive, I'll tell you, when I was running the hospital, I was not a fan of remote work. And that was just because I was not used to leading and managing people external. I like to be able to watch what was going on. I had a framework that I used to use that you inspect what you expect. And so that was a lot about rounding, being present. And I couldn't do that when people were remote. So I had to pivot very quickly as an executive to basically say, how do I quantify the work? How do I put a performance management system in place where someone at home can still tell me what they're doing, how they're adding value, and how they're using the company time wisely? On the converse, I now am a remote worker and I like to take my good naps and get up right before my first meeting and, exercise my entire lunch hour. So I will tell you that there's just a lot of opportunity to improve your professionalism or to regress just a little bit. And you have to know who you are and how to operate within that space. So from the pandemic perspective, some folks have felt that professionalism has been lost. People are wearing hoodies and sweatshirts to their meetings where they would not have worn that normally. There's a level of casual dress and attire that people have taken on their Zoom. And that doesn't always lend to professionalism depending on your industry. We also have looked at a market analysis around productivity. And although you think you would be more productive at work, you are actually not achieving as much in the 8-hour span as you were when you were working prior, unless you have a job like customer service where you continue to have that cadence of customer interaction. So there is a loss of productivity. So you should make sure that you're offsetting that by either sharing with your superior what you're doing, creating some type of log about the work that's been done, or creating a frame where on a weekly basis you can speak to your accomplishments so that that perceived loss of productivity doesn't end up in loss of jobs or a perception of your performance that's suboptimal. And then what has increased, though, is your flexibility. The trust that your managers and that your organizations have given you to self-start and to be able to do all that you did in the workplace from home. And so for some people who have a high level of self-motivating behavior, that's beautiful to be able to work from home and to have that flexibility. But I just wanted to give the big picture that says to both employers and employees, you have to know how to optimize yourself and how you show up for work, whether you are in person or remote. And think it not strange if some people are asked to return to work because they were not able to find that way to quantify and measure their output. So we can go to the next slide, please. So I saw something in the chat, Kenneth, I'm going to preempt a little bit. It says some people are working more hours due to the pandemic, and that's true. And we'll talk a little bit later about boundaries, because there are some people, because you're at home, you keep your computer on the whole day. You wake up, you go check in. Right before bed, you go check in. And that's not always great either, because that's not really how the healthiest boundaries are observed. And we want to make sure that you have a difference between that work and that life. So we'll talk a little bit more about this. So let's talk about reopening considerations. This is really organizational prep for people who run businesses or who are about to re-enter, and how they can use this checklist to make sure that their workspace is, or that their organization has appropriately planned and contemplated for their return. And it is incumbent upon your employer to maintain a safe work environment. And so where these things may not be present, you have the unique opportunity to go back and to say to whoever is in charge of your workforce reopening that there are opportunities for improvement. And you can provide this to them, because all of this, again, is evidence-based, and we'll give you the links in the chat. So in order to prepare for your office, you really just want to look at its occupancy. How many people have been there? How long do they have to be there? And you need to look at the geography and the landscape. So additional operating expense has come into every industry around deep and terminal cleaning, and that needs to be a strong consideration in reentry. No one wants to go to work when they don't know who's touched things, how frequently high touch surfaces have been wiped down, et cetera. And so it's very appropriate, and I would say it's incumbent upon, again, the leadership to be transparent about the cleaning schedule. We need to make sure that workspaces are modified. So if you need to turn people back to back, if you need to look at a staggered work schedule, so all the same number of people aren't in the office as has been in the past, or that people work different tours, different weekdays, I think that's the best way to re-enter the workspace. Unless everyone has to be there together, give people the option of self-scheduling. And that level of autonomy just makes people buy in differently. So we have to prepare the workspace by terminally cleaning and having a cleaning schedule. We have to make sure the workspace has been modified to accommodate for social distancing. And that can include really changing just the composition of desks, looking at non-traditional workspaces like conference rooms and cafeterias, because they shouldn't be used for those purposes any longer, and maybe how to outfit them for more large group workspaces, and also contemplating work differently by having people, again, with different tours. We look at reduction of touch points. And so that is to say, if someone doesn't need to be back in the office, don't bring everyone back just for the sake of inclusion. If the administrative staff can do their work effectively and efficiently from home, my thoughts and the recommendation would be to leave them there, so that the people only who have a requirement to be in office are the ones that are brought back. And then provision of PPE is an absolute must. You have to ensure that you have your mask available. It's great to also have gloves. A lot more hand sanitizer throughout your office environment is appropriate, and also really just having wipes. And I know some of these things sound small for folks, but when you are dealing with someone who has anxiety, or when you are the one carrying the anxiety about going back into the workplace, it's these things that are available to you that will immediately de-escalate and help you feel more safe and provided for. And then you can also refer to, from the regulatory perspective, OSHA has a very clear and unambiguous playbook for how to re-enter or how to reopen workspaces. So if you are absent of thought about what to do, you can go to OSHA for that playbook. I'm going to go to the next slide. And we talked about adjusting and staggering shifts and the requirements about social distancing, but we're going to send you this whole slide deck. So we wanted to make sure that the things that I was verbalizing were also a part of the written presentation. So we can go to the next slide. We want to talk a bit about leveraging technology, and that is something that not just in the professional workspace is required, but also personally. You can increase your productivity, and I have a slide later that talks about 7 key strategies to increase your productivity, but learning to automate and really looking at ways that technology can augment or supplement the work that you're doing are key. So leveraging virtual meetings, I feel like the Urban League was ahead of its time with this digital success series, because I don't know if it happened before or after the pandemic, but the fact that it comes to you, it's short, it comes to your desk, and it's interactive, it's already begun a framework that I think the pandemic has pushed us all into or required us to go in.
We were in full digital career success series mode prior to the pandemic. So yes, we are the leaders in this space of leveraging technology for professional development. Indeed. You know, you mentioned leveraging technology, but even just to, and you can touch on this or correct me if I'm wrong, but even just to make yourself aware of what's going on and what you can do out there to protect yourself. Like, I just think that there's so much information out there. And I know you shared like an OSHA link. I believe I saw the Kanji put it in the actual chat, but just staying up to date on what's happening and what you can do to protect yourself from COVID, and especially in the workplace. I think that's probably important to leverage technology in that way as well.
Absolutely, absolutely. So the research arm is key. The CDC has wonderful materials. There are a couple McKinsey articles that I put in, and why I put the McKinsey studies in are because they do 50-state surveys, and they really have statistically proficient evidence that speaks to their claims. And that's what I like to use. I don't want to go on speculative information. These materials and these links really help you get the best information. And to your point, knowledge is power. So leverage your research arms, leverage your virtual meetings, and make sure that you also automate where someone might have brought a piece of paper to you in the past. where a form may have needed to be manually signed, automate it. Use e-signatures, figure out ways that you can use repositories like Dropbox or Google Docs to really be able to convey and share information. So this has pushed us into tech platforms that we would have probably been piloting for many years, and we're there. So don't regress at all, and don't go back to the status quo from before the pandemic, where we actually have been able to really leverage technology differently. And I've seen that beautifully done in the education space. So applications like Canvas and remote learning, where students have really been able to connect where their broadband internet has been functional enough, and we don't want to get into that, but where there were means, students did have accessibility to the information and the knowledge of the school system. And I think that's just an example across industry of where we don't want to regress, but we just want to amplify that. And so we talk about closing or limiting break rooms, which I spoke about before. And while that may feel like a drag, sitting at your desk and eating is the safest place for you. You don't know where folks have been. You don't know what they've been touching in terms of doorknobs. So it's always good just to limit your interactions. And while you do want to be social like myself, you also want to make sure that you are maintaining that separation. And for businesses and locations where you do have visitors, my thought is that you should really not prohibit per se, but strongly eliminate and review your visitation processes and policies to make sure that you're not just increasing traffic unnecessarily. And then we need to talk about health screenings and attestations. I think that most healthcare entities and schools have moved to a daily check that you attest that you don't have fever, symptoms, cough, or an adverse travel history. And that's something that I think is a best practice for all employers to conduct. It's not difficult. It requires just, a closed architecture kind of survey monkey, and you get a pass for the day. And that really helps other people know that unless you're lying, which some people do, but on an honor system, if you are telling the truth and you are screening into work, you should feel safer being around your colleagues because they have not exhibited any signs or symptoms. And then when we talk about preparation, I would say consideration of a chief kind of COVID officer or someone who's a COVID czar, so that you can do what Ken said, someone who goes and checks the CDC website once a week or once a month, or who is your environmental or industrial hygiene officer. They can be the one responsible for reviewing these guidelines to make sure that the workplace is safe. And that's the level of preparation that I think all employers need to consider when reopening. So I'm going to pause there because the next slides are about employee-facing kind of subject matter. So I just wanted to know, Kenneth, if there's anything in the chat or if there's any topics that we need to revisit kind of before shifting gears to the employee side.
Yes, thank you so very much for that. Specifically, nothing in the Q&A, but please, I know you guys are out there. If you have some questions, actually something just jumped into the Q&A from Miss Lorenda Harper. So really quick, many companies spent thousands of dollars to refresh their offices prior to COVID, to have shared open space or individual stations. I wasn't a fan to begin with. Do you think this will change after we get through this pandemic?
So I think just because having run a business pragmatically, I don't think they're going to change their architecture. I do believe that there need to be modifications to what they built out. So in very large shared workspaces, we might need to put up some partitions. We need to ensure that, again, the number of people in any workspace has already been contemplated. And when with 6 feet of distancing, where you might have had 10 or 11 people in a space, maybe there can only be 4 or 5 people. So I don't foresee, and I don't think folks should expect that their organization may, dial back or walk back their change in architecture, but it is their responsibility to modify that architecture to make sure that you're safe. And what I've seen really beautifully is, small plexiglass enclosures throughout the workspace for people to be able to be safe.
Just to speak about your initial slide, I think it was so important to start with that, and kudos to you for kind of understanding and realizing that there's so many things that we can do as individuals to help protect ourselves. It might not be a 100% solution, but it's something that can at least let us know that we're doing the things necessary for our own selves to prevent contracting COVID. And I think that's a big piece of it. Although these organizations need to do everything in their power to protect the safety of their employees, but still remember that you have to be mindful and diligent yourself as well.
Absolutely. And I think that one of the arguments, and I like to just, in order to really give truth to power, you have to speak to what folks say behind closed doors, even if it's not, well received. We ride the train to get to work, and we are in the grocery store, and we live our life interacting with people in much closer proximity than you will likely interact with them in the workplace. Where you have to expect your organization to come through for you is to provide you with the personal protective equipment, to allow for appropriate social distancing, and to give you the flexibility, if you truly are exhibiting a lot of anxiety around this, to have an accommodation request met. And that's more in the human resource space. But if you truly feel that you cannot go back to work for various reasons, then you have to have a conversation, with a health professional and talk about accommodations requests or other type of leave. But it's appropriate to expect that when you get back, your cubicles are disinfected, that they're sufficiently spaced. And if you don't have to work with a ton of people at the same time in the same shift, that scheduling has been adopted. And that's, I think, what you should realistically expect from your employer.
Amazing. Eboné Carrington, Urban League Jobs Network Digital Career Success Series. Let's keep moving.
Let's go. All right. So can we go to the next slide, please? So this is kind of, if we were watching Saturday Night Live 10 years ago, they would say, read this and then discuss it amongst yourselves. But this is a conversation piece that I wanted to just offer you, not to discuss in great detail now, but for you to talk about within your professional circles and maybe even as a case study in your workplace. And it talks about the adoption and the kind of proliferation of AI, or artificial intelligence, and how people that work in high physical proximity workspaces or broadbands, meaning how many people do you have to interact with every day? How close do you have to be with someone? And is your work remotable, is what proximity equates to. So I give you the highest proximity industry being healthcare. You have to stand close to a patient. It's not optional, really, not to have the patients come. As a nurse or doctor, you have to work around a patient at their bedside or in the operating room where there is an appropriate social distancing. So that's a job that has high physical proximity. One that's low would be remote work. One that's low would be, if you work in an individual office and you're an entrepreneur and someone else is in another room. Those are low proximity positions. And that's where artificial intelligence doesn't have a lot of space. But in these other realms, we should really be looking at automation. And so I just wanted to share that with you, that if you are in an industry or a work environment where you do have to be in close physical proximity, automated intelligence, artificial intelligence are the way to go. And in healthcare, we do that through our laboratory technology. We have robots that pick our medication for pharmaceuticals. So there are a lot of things that are moving and shifting. It does lead to potentially a reduction of jobs, but there's opportunity to retrain and to take the workforce and redistribute it. So I just wanted to share that with you because that actually came from an exhibit in the McKinsey link. And I thought it was very interesting for people to understand the trend, but also for people who are STEM oriented. If you are into computer science, if you are the person who builds things or who is an innovator, you need to be looking here and you need to be incubating some thoughts around what you could potentially be building for healthcare and others.
There's definitely a future of work conversation there, right? Mm-hmm. And I think people sometimes look at that as a negative, but there are opportunities out here. And as we continue to have DCSSs throughout the season, we'll speak about some of the avenues for people that can upskill, reskill, and find opportunities within the new AI and VR augmented workforce realities that we're getting ready to come upon us. So I appreciate you bringing that part in because really that's the way things are going and there's no way around it. So we just need to maybe not fight it, but adjust accordingly and be successful within that space.
Right. And I'll give you a small example. If you thought you were a prolific orator or you really loved public speaking, there's really no venue for that anymore. So, people like you or I who have to talk to a lot of people, we've had to practice this new look at a screen. You don't get any body language, nobody, so I've had to learn how to hype myself like, oh, Eb, you're killing it. Well, thank you, sis, because there's no back and forth anymore. And so we all have to pivot our skills and how we operate to be more virtually inclined. So learn how to engage across Zoom because it's not going anywhere. You're not going to be back in large auditoriums anymore. So learn a new skill. And so I think that was a great segue. So we can go to the next.
Hold on. Let me help you out here, Ab. You're killing it.
Oh, thank you. Thank you.
I've been looking at the info in the chat. They think you're killing it as well. So let's keep it moving.
All right, we'll keep it moving so that we can talk more. So let's go to the thank you, Michelle Cummings. So what employees need to know about how to kind of leverage best practice from the pandemic. So people feel a bit put upon when someone says you have to go back to work next week. It doesn't give them time to calibrate and adjust to reentry, time to create a family support plan. And so what I've heard from employees is that they're in some ways resentful when you have to go back to the workforce, but you haven't been given that time to rev up. So I would offer to employers, give a 30-day heads up, if not 30 days, 2 weeks, so people can get themselves together. If you know that you have the kind of work environment where people can bring you back on a dime, then already have your support plan in place. Know what happens if next week they say you have to go back to work. Who's going to pick the kids up from school? How are you going to modify your plans? Are you going to take the train at a different time because you might have different fear factors? So really coming up with your own plan and making sure that you talk to yourself a lot about what's causing the anxiety or what's causing the trepidation for wanting to re-enter the workspace is something that you're working through. And then also for the parents, there is a framework that's being moved forward by the federal government on test to stay. And so it was something that came. I have some clients in LA County, and they really did the research on this and started the sponsored project. If you test sufficiently, you don't have to close schools. And that's about really doing sophisticated contact tracing. It's also about making sure that there's no loss to education and to teaching. So I'm just going to give you a heads up. I was very nervous because for the past 2 years, everyone who was learning to be a doctor or a nurse had to do most of that learning virtually. So the didactic, the rotation, really some of the interpersonal that you would have with your senior attendings, you didn't have. Now, don't be afraid. These people still had to evidence their competency by passing their board certification, and these are still brilliant people. But how they learned how to be a doctor was very different than 5 years ago. And so I want to just share with people, you must be flexible. You have to be open to change. And it is that nimble spirit and the gentleness that you have to exercise yourself that I'll continue to remind you of. So basically get your plans together. Make sure that you know what you're going to be doing when the pandemic's peak subsides or when we plateau. I also want to let you know that, as we talked about before, there's such an uptick in e-commerce or virtual transactions that you just have to be mindful of that. And for people seeking jobs or looking for their next career opportunity, telemedicine, online banking, and streaming entertainment are the top 3 career areas or career tracks that have taken off since the pandemic. And then really amplifying and creating, if you don't have one, but making more robust, if you do, wellness programs so that people know you care about them. Mental health coverage and EAP programs are things that employees do want. And so I offer this for those of you who are running businesses, but in the event that you are a new employee, understand what your EAP programs are. And so EAP is Employee Assistance Program. Usually it links you to services that are necessary around therapeutics or mental health, but also supportive housing and different things can come from EAP programs. So make sure that you're aware of those. And if you don't have them, you can seek them externally. And then what people really want is empathetic leadership. If you are a leader, if you are a manager, don't be a jerk. Where you can be flexible, where you can work with people, where you can have frequent communication about what's happening, knowledge is comforting to people, and being in receipt of information from their leaders is what people crave most. And then I just have to say, it's a part of my leadership frame, but I think it should be everyone's, is to have a gratitude focus, beginning and ending with thanks and making sure that people know that they are absolutely essential resources for your organization, whether they're essential workers or not, is kind of important. And it's a motivating entity that I think moves people forward. So these are just some of the enduring changes to operating models that I've researched. And then I think we're on our last slide. So we're rounding into the home stretch. So if we can go to the next slide, it's, I think, ways to improve your productivity. Yes, it is. So get out of your own head. Keep your job, keep your sanity, and keep going. If those are the 3 leading principles for you, then you'll be okay. But productivity is a construct that comes outside of you. Make sure you know what expectations need to be met by your employer. Make sure that you are capable and have the knowledge, skills, and abilities to perform that work, and then move on. Organize your day, though, so that you're able to really have some small victories. Your to-do list shouldn't keep cutting and pasting to the next day. Cross some stuff off. Make sure that every day it counts. And I would actually, to some points that we made earlier in the talk, create some kind of report for your superior or those around you so that your work is documented in a way that it can be well tracked and organized. And then use other people's time. Delegation is key in productivity models. And we have to make sure that in reducing your own stress to be more productive, that you share it. And that's about delegation. And focus on completion of tasks, but work in chunks. So what I would say is no human being works and powers through 9 to 5. If you know you're a morning person, block that time off, get your deliverables done, and then rest a bit, and then go back into a different chunk so that you know what to expect for yourself and people can understand what cadence of deliverable they should expect from you. Allow time in terms of work-life balance. And again, we've talked a lot about using technology and automation and the keep learning. And I think this is the last slide. Is there one more, Dory? So
Yeah,
there we go. We will end with wellness. So this is about anxiety, stress. There actually is something called pandemic stress. And so I wanted to just say this quote aloud because I'm an extrovert sometimes. But whether you're an introvert or an extrovert or somewhere in the middle, there's a little rationale around anxiety. And you have to make sure that it's not perceived as unfounded. It's not to be stigmatized. But you can prevent that by just having a social life, having healthy encounters, and by making sure that you focus on what you can control. You evidence strategies around, I would say, contemplative practice, deep breathing, meditation. You set healthy boundaries, and you have a safe space. You have somewhere or some person or some place that you go that makes you feel good and alive and vibrant, and that you also embrace the outdoors, that you do more things outside because it's safer. And also, I go to a church that's all about service, so I can't not talk about living and loving and serving, and that is about giving back, and to make sure that that feeling of reciprocity is a part of your headspace when you're reentering the workplace. And then live a little and exercise gentleness and kindness. So it's kind of like, and I'm not that tree hugging hippie, but it is, love yourself, hug yourself, and just get through this so that we can learn and live and grow together. So with that, I will thank you so much for your time and attention. And then we can go to Q&A.
And I appreciate you so much. I'm not the tree-hugging hippie. No, that you're not. But I do think that, man, you do a great job of just exercising gentleness and forgiveness. I really believe that's a great part of your character and who you are. So thank you so very much for doing that with us today. That was an amazing presentation. We were speaking about productivity, and one of the questions in the Q&A kind of is about people kind of using their time or newfound time to take on another full-time job. And I think it's a dangerous mix, right? I don't know, everyone's situation is different, but I do believe that you can put yourself in a position where you're overworked. And I know sometimes it's a necessity, but how do you feel about people taking on second full-time jobs because they're working remote and they believe they have a little more time?
Yeah, well, I also saw, and I thank Toy Valentine for that love in the chat. I would say that I would be really cautious about taking on another full-time job in that space, because unless it's something that's totally doable. So you know yourself, and you know how cerebral your work can be. You also know, so I used to say I love being a receptionist because I love picking up the phone. I love talking to people. And so if I had 4 hours in my day and 2 of them I could devote to doing that might bring me some joy. But I don't think people should be chasing busyness. And that's what I hear a little bit in your question, Kenneth. So if you have time in your day and you need money, getting another job is logical. It's solving a problem and you're being a responsible adult. But if you are missing time and just trying to fill it by being occupied, I would offer you to look at some other strategies. Find a different hobby, find something that brings you different joy and that exercises a different part or portion of your brain. So if you are really, really scientific and, let's just say meta-oriented, do something creative, take a different class, learn Pilates, do something else to round out yourself than just taking on another job, because that's where that balance, I don't think, is easily exemplified.
Man, Kanji, thank you so very much for dropping all these McKinsey study links in the chat. Please take advantage of that. Pull those up while you're listening to Eboné give her lecture on this topic. Eboné, I want to speak to you about something else within the framework of what we were just speaking about. I know there are some people that have taken the opportunity to really jump in with both feet into their side hustles. They have a little more time because they're working remote. And they have some flexibility, and it's allowed them to pursue some other things that not only are work, but that maybe make them happy, right? And maybe, so it's a passion project. How do you feel about that?
I think that's just the exact answer, said so much better than I did. To your prior question, I think taking on a passion project or giving time and space to a hobby or something that you wanted to endeavor towards prior is important. I've seen people who have written books that are just next level with their spare time. I've seen people lose 100 pounds. I've seen people really just change the way that they think and that they see the world because they've used their time wisely. The takeaway here is time is capital. It's a commodity. And if you use it to better yourself in some way, whether that is a class, taking on a different skill, giving airtime to a hobby, taking up a passion project, that is the best use of your time. Kind of self-medicating. A lot of people we didn't get there because that wasn't what this was about, but during the pandemic, a lot of people took up, at-risk behaviors. And it's time for us to call that out so that those at-risk behaviors don't become habits, or that doesn't become their new character trait or their new normal. So I would just say use your time wisely, constructively, and in ways that are going to benefit you, your family, or your business.
Yes, indeed. A lot of people have chimed in asking if this will be available to you, this actual video, and this and the majority of our digital career success series shows are available on YouTube at the UL Jobs Network YouTube channel. So please go over there, and this probably will be up in a couple of days, but you can look at past DCSSs and take that content in as well. So we're here with Eboné Carrington on the Urban League Jobs Network Digital Career Success Series. Eboné, I have another question for you. How do you suggest handling being around unvaccinated people who are insistent and they are in your circle?
Well, I have some unvaccinated people who are insistent and who are in my circle. So I will just speak my truth. I continually remind them of the need for me and my family to be safe. And that's different than asking them why they're not vaccinated. So I think it's just a part of like behavioral interviewing, and it's just a communication strategy that can be used when you're talking to someone instead of shaming them and blaming them around not being vaccinated. Reinforce the need for you to maintain your safety and for you not to carry anything home or around that you wouldn't want to. And that's the best way to talk to people who are unvaccinated. I also limit my interaction, quite frankly, because I'm not certain of what they have. But I want to give you the Omicron conversation about vaccination. Omicron is the most virulent variant we've seen to date. People who are totally vaccinated and boosted from COVID have been acquiring it, or it's a communicable disease and they've been getting it. What they haven't gotten for the most part, and this is not an all or nothing, but what they haven't gotten was critically ill from COVID, hospitalized from COVID, or taken down in a significant way. So I really want to be honest about the information that I'm sharing. Your vaccination status isn't going to make you more or less susceptible to getting COVID. That is your behavior, your mask wearing, your social interactions, where you choose to go and how you choose to show up there is how you can contract COVID. How sick you get from COVID is based on your vaccination status. So I think and I would love to have maybe the secondary part of the question is, an unvaccinated person does pose more risk because they have the ability to shed more virus. but a fully vaccinated person can also be an asymptomatic carrier. So what you can do to be the safest is to exercise those tools from the first slide. Stay away from people this close. Let everybody exercise their space. Think about how often you have to be around people personally. And I have a best friend who happens to be watching this right now because she was in the chat, and she loves to go outside. She's one of the most personable people I know. And because she lives with older adults, she hasn't come out. And so that's responsible. She hasn't come out. And so I just think that you have to decide where you're going to be. If we're talking about the workforce or the workspace where you have to go there and that unvaccinated person has to go there, just be safe about it. Don't eat or drink with them, because that means you have to take your mask off. Wear some eye protection, because it's the eyes, the nose, and the mouth that are the contact sites or the contact sites. So just preserve yourself and maintain your own safety. And if that's a friend that you love and care about, have the conversation with them intermittently about when they would be more comfortable. And for some people, I've just heard it's not a no, it's a no for now. It's a no until a million people get it. It's a no until I see somebody else have it. And so it's just everyone's triggers are different. And I would just say exercise that same gentleness and forgiveness with them. And if they feel strongly that they don't want to be vaccinated and you're not with it, then just stay away from them, talk to them on Zoom, and see them after the pandemic.
Oh man, great advice. Hi, Eboné's best friend. We appreciate you joining us today. Hey, listen, real quick, I never even thought about having protection for your eyes.
Oh yeah, eye protection is key. And so what you'll see in healthcare settings is that you have the individuals wearing their N95 mask, and you'll also either have them wearing goggles or the type of mask that has a small protective shield on the top. And for me, I wear, glare resistant glasses when I'm on the train, just like this. They're not prescription, but it's just so that no one can sneeze, or that I don't go like this, which is my custom, and take what's been on my hand or what's been on the pole and put it in my eye. And so that's also a part of prophylaxis.
And that's great information, Ab. I really appreciate it. As we go through here, we have some other questions. Let me jump into this. Joanne, thank you so very much. Balance is so critical, as we know. With the conversation about COVID being so all-consuming, I think we're in grave danger of becoming obsessed with negativity. Any advice as to how a leader should seek to inspire their teams, cultivate innovation, and focus on positives?
Absolutely. And I'm going to say absolutely, because during 2020, in that hospital, there was nothing but dread, death, and a lack of hope. And what we did was we came together to broker joy and wellness in the workplace differently. So from a leadership perspective, we sent out, and these are just examples. So we sent out inspirational quotes every day, and people really responded to that. Just one or two liners from really brilliant people. And there was a website we went to, and it was just a different quote every day as a centering thought for people to motivate. We began to pipe classical music, therapeutic music across our internal systems, so that people, whether they knew it or not, were already in a more calming space and work environment. We began to actually talk about second victim and having second victim debriefs, meaning in healthcare, and this is just where my expertise is, in healthcare, when you make a mistake, when a patient dies, or when you're in a situation where you're facing a great deal of anxiety, you have the ability to talk about that with someone, a battle buddy. And so we created a battle buddy program, and you can do that anywhere, where there are people who are trained in mental health first aid. And when someone's in trouble, when you notice a change in their behavior, when you can see that they're kind of despondent, or that their mood and affect has changed, you can go call one of those battle buddies, and they can go and do an intervention. And when you have a colleague that just comes to you and says, I see you, and I'm here if you need help, or there are some ways to get support, it destigmatizes, oh, maybe you should go see a therapist. It's different when it's just a person that says, hey, I'm stressed out too, or hey, I see that you've not come to work a lot, or something like that. So I would say motivating and inspirational quotes, making sure that people can take their time off, because it's been really crazy these past 2 years. And I've heard people say things like, I haven't had a day off in 6 months. That's not okay. I haven't had a vacation in X. That's not okay. You have to be able to unplug from work in order to recharge, so that you're sufficient for the next next wave or the next phase of life. And so you cannot pour from an empty cup. I say that all the time. So as an employer, you can make sure that your team has taken their time off, that they know they can prioritize their wellness. I would start small wellness programs where you do a walking club. We did that at Harlem. We had a girl trek group where we just walked around Harlem, 4 square blocks every day. And so the possibilities are endless. And I would say there are a lot of frames for joy in work and for wellness in the workplace. But as a leader, it comes from you. And so making sure people can have balance is important. Making sure people do feel respected is important. And like every month, just send a thank you. If there's a metric that the organization hit, celebrate that. It's not always about, parties and pizza and, cookies and punch. Some of it is just saying thank you. We did it together. And I know it wasn't easy. So as a leader, it's really about employing strategies that can help people want to come back to work and that make sure that people feel that you're looking at them as an individual and not as a commodity.
Well, thank you so very much for delivering an amazing presentation today. And we did it together, but you made it look easy. So I'm gonna go with that, right? Listen, I'd like to thank everybody for dropping the questions in the Q&A and all the activity in the chat. We really appreciate you. Thank you so very much for joining us today for the Urban League Jobs Network Digital Career Success Series. If you want to stay in contact and just up to date on all things that are going on with Eboné, she's on LinkedIn. She's pretty heavy there, and I see her on Instagram as well. If you want some information about myself and the work we're doing here at East Coast Executives and Black Box, please do not hesitate to visit our website. Hit me on LinkedIn. That's what I do for a living. I'm a recruiter, so I always appreciate that. And Instagram, kljohnson.info. We're going to do it again, and I believe we're going to do it again real soon. We have another Digital Career Success Series coming up February 2nd, same time, 12 to 1. This is my girl right here. Career Transitions with Julia Rock of Rock Career Development. I'm excited about Julia coming on. I can't wait to put her on the spot about some of the new things she has working and her sharing that information with you guys. So please join us next week. But I'd like to thank you for joining us today. On behalf of the National Urban League, Wanda Jackson, Dory Brown, and I know Kanjit was back in the background helping us out as well, Dave and the whole Urban League Jobs Network team. I'd like to thank Eboné Carrington for just blessing us today with an amazing presentation. And of course, I'd like to thank you for joining us today. Thank you for holding tight and coming back for a new season. My name's Kenneth L. Johnson. We'll do it again next week. Julia Rock, February 2nd. I'll see you soon.